of 2025. From being in Pakistan when the journey started in 2016 to nearly a decade later, it is my honor to be your co-host tonight.
And my name is Salman Azam. Together, Shanur and I are delighted to serve as your MCs for this special evening as we celebrate our journey of empowering and educating communities while spreading the message of prevention. I get the privilege to start by introducing my amazing co-host. Shanur is NYU bound on the pre-law track in January. She's also been part of IPAC since its earliest days, watching it grow from a dream discussed at her family's dinner table all the way to the remarkable global initiative it is today.
Joining me as a co-host for the evening is Salman Azam, a true community lawyer whose commitment to service extends far beyond the courtroom. He's been with IPAC from the very beginning, helping to shape this foundation while providing invaluable legal counsel along the way. He's an integral part of our family and the IPAC family alike.
Honored. Before we begin, we wanted to take a moment to recognize some important individuals who have taken time out of their busy schedules to support IPAC tonight. First and foremost, we are honored to have in attendance Chicago's newest Consul General of Pakistan, Mr. Zaman Mahdi.
We are also very excited to have Mr. Azhar Hamid, a renowned philanthropist and visionary leader who flew from Los Angeles to honor us with his presence, as well as Tariq Khan, president of Open Global and a professor at NYU. Shout out NYU.
Yeah. I'm so glad that you mentioned Open because it reminds me that I want to congratulate and recognize some Open individuals who are here today. Congratulations on a very successful event earlier today. Over 200 people at your Chicago conference. So Amr Chalisa, as the executive chair, Bob Arator, the president, and so many people who did the conference and then came here to support IPAC. We appreciate you. Last but certainly not least, it is very fitting that we are celebrating IPAC's first gala at the Doubletree here in Oak Brook, Illinois. So we are honored to have in our presence the mayor of Oak Brook, the Honorable Larry Herman, who always supports us with everything we do. Thank you, Larry.
Thank you all for being here at our inaugural event. It truly does mean a lot to us.
This evening would not be possible without the dedication and the support of the Board of Trustees of IPAC Foundation. These are visionary leaders who have guided the mission from the very beginning. We are deeply grateful to them for coming and taking time with us and spending time with us. If you can all rise so that we may recognize you, the Board of Trustees of IPAC Foundation. And now, to begin the formal proceedings of this beautiful evening, I will start with the recitation of the Holy Quran. I will be reciting Surah Fatiha, the opening, followed by the translation. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. All praise be to Allah, the Lord of all the worlds, the most compassionate, the all-merciful, the master of the day of judgment. O Allah, you alone do we worship, and you alone do we ask for help. Guide us upon the straight path, the path of those whom you have favored, and not of those you are displeased with, or those who have gone astray.
Thank you, Salman. Next, we request that everyone please rise as we play the anthems of the two countries near and dear to us, Pakistan and the USA. Let's take a moment to reflect on the journey that has brought us here. A journey of commitment to prevention, community health, and building a healthier Pakistan. Here's a short video introducing the IPAC Foundation, its vision, and the incredible impact it has made over the years.
कुछ मुहिब्बे वतन पाकिस्तानियों ने अपने हमवतनों की खिदमत के लिए IPAC फाउंडेशन की बुनियाद रखी। IPAC फाउंडेशन SECP, FBR और PCP से रजिस्टर्ड एक फलाही इदारा है। V4 IPAC फाउंडेशन का एक इनकलाबी प्रोजेक्ट है।
अस्सलाम वालेकुम, मेरा नाम डॉक्टर मोहम्मद समीर शफी है। मैं बतौर चेयरमैन बोर्ड ऑफ ट्रस्टीज IPAC फाउंडेशन की सरपरस्ती कर रहा हूँ। IPAC फाउंडेशन के आगाज़ में हमने मेडिकल एंड डेंटल कॉलेजेस के स्टूडेंट्स को बतौर वॉलंटियर इंगेज किया। इसका मकसद था कि मुल्क भर में कम्युनिकेबल डिजीज़ के खिलाफ आगाही मुहिम शुरू की जाए। इस दौरान हमने महसूस किया कि प्रिवेंशन के लिए टेस्टिंग बहुत ज़रूरी है, जिसके लिए हमने हेपेटाइटिस B and C के फ्री स्क्रीनिंग कैंप्स लगाए और पॉजिटिव पेशेंट्स को ट्रीटमेंट सेंटर्स में रेफर किया। अब हम मुल्क के तूल और अर्ज़ में जदीद तर्ज के कम्युनिटी हेल्थ सेंटर इस्टेब्लिश कर रहे हैं, जिसमें एक छत के नीचे इलाज और मुआवजे की हर सहूलत दस्तयाब है। साथ ही साथ प्रिवेंशन पर मुकम्मल फोकस किया जाता है।
चिरागदीन कम्युनिटी हेल्थ सेंटर सियालकोट अपनी नौयत का पहला अवाम दोस्त प्रोजेक्ट है, जहां हेपेटाइटिस, TB, HIV, रेडियोलॉजी क्लिनिक, आई क्लिनिक, वुमेन चाइल्ड क्लिनिक, फार्मेसी, लैब और इम्यूनाइजेशन से मुतल्लिका 54,000 से ज़ायद अफराद को तिब्बी सहूलियत फराहम की जा चुकी हैं। اس کے علاوہ سیمینار اور ڈور ٹو ڈور آگاہی مہمات کا انعقاد بھی اس پروجیکٹ کے نمایاں خدوخال میں شامل ہے۔ آئی پیک فاؤنڈیشن بہت ہی جلد اسی طرز کے مزید 2 ہیلتھ سینٹرز، آئی پیک کمیونٹی ہیلتھ سینٹر ٹوبا ٹیکسنگ جو کہ تکمیل کے مراحل میں ہے، آئی پیک کمیونٹی ہیلتھ سینٹر جھنگ کی بنیاد بھی رکھ چکا ہے۔
ہیپاٹائٹس کلینک لاہور ہیپاٹائٹس بی اور سی کی اسکریننگ اور علاج کے لیے مخصوص ایک قابل اعتماد کلینک ہے جہاں آنے والے مریضوں کو اسکریننگ، علاج اور ادویات بالکل مفت فراہم کی جا رہی ہیں۔ عوام کی فلاح کے لیے موبائل یونٹ سے طبی خدمات کی فراہمی اور خصوصی کیمپس کا انعقاد بھی عمل میں لایا جاتا ہے۔ کلینک اور ان کیمپ سے اب تک سینکڑوں مریض مکمل صحت یاب ہو چکے ہیں اور یہ سلسلہ بدستور جاری و ساری ہے۔
آئی پیک فاؤنڈیشن نے حال ہی میں سریا شفیع ڈینٹل کلینک سیالکوٹ کا آغاز بھی کر دیا ہے۔ جہاں پر کسی بھی طبقہ سے تعلق رکھنے والے لوگ اس سینٹر سے بآسانی مستفید ہو سکتے ہیں۔ سریا شفیع ڈینٹل کلینک خصوصی کیمپس کے ذریعے اور کلینک میں تشریف لانے والے اب تک سینکڑوں افراد کو اسٹیٹ آف دی آرٹ سروسز فراہم کر چکا ہے۔
کسی بھی نیشن کو بلڈ کرنے کے لیے ہیلتھ اینڈ ایجوکیشن بنیادی ضرورت ہے۔ آئی پیک فاؤنڈیشن ان دونوں کمپوننٹس پر فوکس کر رہا ہے۔
ایجوکیشن اینڈ ٹریننگ پروگرام کے تحت نسل نو کو حفظان صحت کے اصولوں سے روشناس کروانے اور جدید سہولیات کی فراہمی کے لیے ایف ٹی اسکول نوشیرہ میں واٹر فلٹریشن پلانٹ کی تنصیب، صاف واش رومز کی تعمیر، کمپیوٹر لیب، لائبریری اور آڈیٹوریم کی تعمیر کے علاوہ حفظان صحت کے اصولوں کی نصاب میں شمولیت اور خصوصی اسکالرشپس کا انتظام کیا گیا ہے۔ اس پروگرام میں وسعت کے پیش نظر ایف جی گرلز کالج میں سریا شفیع بی ایس بلاک کی تجدید نو کا کام بھی تکمیل کے مراحل میں ہے۔ آئیں ہمارے قدم سے قدم ملائیں، قافلہ خیر کو آگے بڑھائیں۔
Thank you. I love a good video and what a moving visual it provides. I think videos like these have the unique ability to bring about empathy and bring us closer to the necessary and important work that is being done. Even if you didn't understand Urdu, the inspiring imagery gives you an idea of the impact that IPAC is directly making in Pakistan today.
It's only fitting that we begin the evening's addresses with the visionary behind IPAC's mission, a leader whose dedication and compassion have touched countless of lives, shaping this organization from its inception. Many of you know him as the chairman of the Board of Trustees for the IPAC Foundation and the Surya Shafi Family Welfare Foundation. He's also the co-founder and chief medical officer of Dialysis Care Center and Kidney Care Centers, organizations that have become pioneers in redefining kidney care and preventative health. With over 3 decades of experience as a nephrologist, he has devoted his life to transforming how we think about healthcare, not as something reactive, but as something proactive, rooted in prevention, education, and community empowerment. But beyond all the titles and accomplishments, at home he's simply Dad. The one who fills every room with laughter, inspires everyone around him, especially me, and reminds us that joy is its own kind of medicine. He has shown me what true execution looks like. It's not just about getting things done, it's about understanding the impact it has on people beyond strategy and vision. It's about heart. The same heart that guides IPAC's mission to heal and protect before illness begins. Ladies and gentlemen, please join me in welcoming to the stage the chairman of the IPAC Foundation, my father, Dr. Samir Shafi, to deliver his address, Curing Mindset Through Embracing Preventative Healthcare.
Good evening and warm welcome to you all. Thank you for coming together to support IPAC mission. And Shanur, Thank you for such a warm introduction. Can I have my slides? So, at the IPAC Foundation, the heart of our mission is simple: to cure the mindset. We must stop waiting for the illnesses to strike and start preventing it before it begins. Ladies and gentlemen, it's time to shift from cure to prevention, and that shift should start now. For centuries, humanity has recognized a simple truth: prevention remains the strongest foundation of lasting health. Long before modern medicine, civilizations recognized that prevention begins with public health. The Romans engineered aqueducts and cloaca maxima to ensure clean water and sanitation, while medieval Europe, in the wake of Black Death, discovered the life-saving impact of quarantine. Hippocrates, the father of the medicine, championed the idea that lasting health stems from balance in diet, exercise, and lifestyle. In ancient China, the essence of medicine laid in prevention, captured perfectly by the proverb: the superior doctor prevents disease, the inferior doctor treats it. With the arrival of Islam, prevention becomes a divine principle. The Quran declares, "Whosoever saves one life, it is as he has saved all the humanity," and warns in Surah Baqarah, "Do not throw yourself into this destruction with your own hands." The Prophet Muhammad reinforced this by teaching cleanliness is half of the faith. Ladies and gentlemen, prevention is an act of obedience to Allah. In the Islamic Golden Age, visionaries like Al-Razi and Ibn Sina advanced preventive medicine through hygiene, quarantine, and diet regulation. Their works, Kitab al-Hawi and the Canon of Medicine, shaped European medical practice for generations. Unfortunately, Pakistan is confronting a widespread yet preventable health crisis. Millions suffer from diseases like hepatitis, tuberculosis, waterborne infections, conditions that preventions can control. I will share some of the data that illustrates how severe this challenge has become. Speaking of hepatitis, 1 in 7 individuals in Pakistan now has hepatitis C infections. In some areas, like southern Punjab, this ratio is far higher than 1 in 7. And almost 20% of the population in some areas in southern Punjab has hepatitis C. 10 million people await treatment. The causes: unsafe injections, unsterilized instruments, quackery, unscreened blood, inadequate hygiene, entirely preventable. Behind each story is a story of suffering. Treating Pakistan 10 million hepatitis C patients, Azerbaijan, would cost anywhere from $600 million to $2.5 billion. And yet, next slide. Pakistan reports 470 new cases of hepatitis C each year. Without halting new infections, it's like trying to put out a fire while pouring fuel on it. With a health budget of 3.2 to 4.2 billion, we spend less than 1% of our GDP on health. Prevention remains the only viable solution. Speaking of tuberculosis, Pakistan ranks 5th globally for tuberculosis, recording over 564 cases in 2022. Again, prevention is possible through early screening, simple hygiene practices like masking, covering cough. Each year, 53,000 of our children die from diarrhea. If action is not taken, ladies and gentlemen, you can see in this table, all the disease numbers will double by 2050. And yet, prevention struggles for attention. Why? Because it's invisible. Requires long-term investment and competes with a culture drawn to quick fixes. It's time to shift our mindset, to prioritize prevention before crisis. In Pakistan, many still rely on quackery and unqualified healers who promise quick fixes but causes lasting harm. You must have seen all these images and wall chalking in Pakistan. Ladies and gentlemen, we realize in IPAC Foundation, investing in children is our way to solve this problem. Investing in children builds lasting health, social change, early prevention builds lifelong habits, influences families and communities, and reduces future healthcare costs, creating both generational and economic benefits. Ladies and gentlemen, Pakistan health challenges are many, but they are not impossible. The future of Pakistan lies not only in the hospital and medicine, it lies in our schools, our homes, and the choices we make every single day. Let's together pledge to spread awareness, to educate our people, to empower every citizen, and to embrace healthy behavior. This is not just a health agenda, this is a national movement. This is our way forward. Thank you. Pakistan Zindabad.
What a passionate appeal. Thank you, Dr. Shafi. I think he's ready for politics, guys. What do you think? Larry, you better watch out. You better watch out. Look, I'd be remiss if I didn't say it. I know we said he's Shanur's dad, right? But many of you know that I have the unique honor and privilege of working with Dr. Shafi in our day jobs at Dialysis Care Center and Kidney Care Center. To be clear, he's actually my boss, but he's also my bhai. As much passion as he has for his work, the dedication and the excitement for the charity, the philanthropy, and IPAC that you see here is a completely different level. We often joke that we do our day jobs just so that we can better pursue our true passions of helping and giving back to our community. So I'll say this, while not all successful people are philanthropists, all philanthropists are successful due to the positive change they make. Dr. Shafi, hi, thank you for always setting such a good example, and your leadership continues to light the way for IPAC's vision and future. Thank you. Next, we are joined by Dr. Sakina Butul. She has been with IPAC since 2017 as a volunteer and is currently pursuing her neurology residency training at Indiana University. As the national president of the volunteer body of the IPAC Foundation named VFAT, which is the Volunteer Force Against Hepatitis Transmission, she mobilizes students across Pakistan, creating a powerful public health movement. Please join me in welcoming Dr. Sakina Butul as she delivers her remarks entitled Representing IPAC and Its Programs.
Hi, Assalamu alaikum and good evening everybody. My name is Sakina Butul and as you mentioned, I'm a neurology resident at Indiana University School of Medicine. My journey with IPAC began in 2017 at Fatma Jinnah Medical University when I joined its volunteer wing, Volunteer Force Against Hepatitis Transmission, also known as VFOT. I've been a part of VFOT throughout my 5 years of medical school and through its various projects that has contributed to my personal as well as professional growth profoundly. And as we gather tonight for this fundraising gala, I invite you to join hands with me in this one powerful mission to prevent infections before they happen and to save lives. IPAC is a non-profit foundation that believes that healthcare should begin long before a patient reaches the hospital. We are trying to lead a shift from treating disease to preventing it before it happens, creating a culture of care that is sustainable. Some of our work is illustrated in the pictures over here. IPAC is registered in both the United States and in Pakistan, licensed under the Securities and Exchange Commission of Pakistan, certified by the Punjab Charity Commission, and recognized by the Pakistan Center for Philanthropy. In 2022, I became the national president of VFOD, the volunteer wing, and I led over 1,000 volunteers and helped establish around 14 chapters all across Pakistan. Altogether, we've built a nationwide youth movement which tries to promote infection prevention in communities across the country. Some of our work is illustrated here. This is me doing some of the projects that I'm very proud to have been a part of. IPAC basically works across 4 main pillars: public awareness, community camps, education and training, and healthcare delivery through community health centers. Each program prevents disease, promotes hygiene, and strengthens community health as a whole. I'd now like to talk about outreach programs through VFOD. VFOD, as I mentioned, is the heartbeat of IPAC. It is a student-led movement which unites future doctors, dentists, and health professionals with now over 4,500 members all across 50 institutions in Pakistan. Through camps as well as awareness drives, our volunteers have reached thousands of people across Pakistan. Our health camps provide free checkups, screenings, and counselings to communities with little or no access to care. And each camp offers both treatment and education, creating change that lasts far beyond a single visit. Some of our work is illustrated here, as you can see. IPAC's proudest achievement is our community health center model, which is a holistic approach to bringing prevention, treatment, and education under one roof. We have our first flagship, the Chirag Deen Community Health Center, that was made possible with the help of the Chirag Deen family. It offers specialized clinics for women and child health, infectious diseases, diagnostics, radiology, eye care, vaccination, as well as pharmacy services. Through the community healthcare services, we have been able to touch thousands of lives. And through our outreach camps, families receive free hepatitis screenings, dental care, and eye exams, restoring health, hope, and dignity to entire communities. Beyond our community healthcare centers, IPAC runs 2 dedicated facilities, the Hepatitis Clinic Lahore and the Surya Shafi Dental Clinic in Sialkot. This is not working.
Yeah, can you go to the next slide?
Yeah. Now I'd like to talk about the hepatitis clinic that we have in Lahore. We basically, through the Hepatitis Clinic Lahore, work to stop the spread of hepatitis by providing free testing, treatment for hepatitis B and C, and awareness for communities at large. And we also provide mobile screening vans to reach our underserved populations. We are all aware that neglected oral health causes intense pain and suffering. And to that end, the Surya Shafi Dental Clinic in Sialkot, that was also previously mentioned, works to provide care and spreads awareness in schools as well as local camps, protecting smiles as well as lives. We also realize that education is very likely the first step in prevention. And to that end, our education and training program, IPAC Renovates Schools, installs water filtration systems and brings infection prevention education to students and teachers, thereby empowering them to create positive change. And in partnership with our Penn school system, we conduct annual health screenings and try to send a digital IPC curriculum, empowering children to take charge of their health. Construction is now underway for the Fatma Ghazi Community Health Center in Toba Tek Singh, as well as the Rana Zaid Community Health Center in Jham. IPAC aims to expand this model across Pakistan while strengthening collaborations with its global partners. I'm proud to be an organization that turns vision into action, and I'm very happy to be a part of it and talking about it after all these years of serving it. Altogether, with volunteers, donors, and supporters, we are working towards shaping a healthier, safer Pakistan for all. When we would be very grateful if you would join us in this mission to bring prevention-based healthcare to multiple marginalized and underprivileged communities all across Pakistan. So thank you so much for joining us tonight, and have a wonderful evening. Thank you so much.
Thank you, Dr. Sakina. Your passion and energy remind us that young people are not just the future, they're leading the change right now. Our next speaker is the operational heart of IPAC, the one who ensures vision turns into action. As COO and a pioneer member, Asia Gosar has led operations, teams, and strategies to bring preventative healthcare to the community level. It is a privilege to have watched your passion for IPAC truly blossom this very foundation. We have a special video message from her tonight. Let's hear what she has to share with us.
Assalamu alaikum, this is Asia Gosar, Chief Operating Officer at IPAC Foundation. For the past 8 years, I have had the privilege of working alongside an incredible team. Together, we identify community needs, design impactful programs, and ensure every initiative is strategically planned, well-resourced, and closely monitored. When I look back, I feel incredibly proud. We began with just one volunteer group, and now we have grown into 50 active medical, dental, allied students bodies in all across Pakistan. Our vision was never just to treat, but to prevent disease and transform mindsets. To establish community health centers that not only provide essential primary medical care under one roof, but also map community needs, educate families, and empower them to adopt preventive measures. Alhamdulillah, we have now one fully functional IPAC Community Health Center in Sialkot and 2 more coming in Toba Tek Singh and Chang, cities of Punjab. None of this would have been possible without the dedication of our team and support of our board members. At IPAC, we understand that every contribution carries our responsibility, and we honor that trust with complete accountability. Now it's time to take next steps. I invite you to stand with us, continue this journey, and help us build a healthier future. Thank you for being here tonight and believing in our mission. क्योंकि एहतियात इलाज से बेहतर है.
Thank you, Asia. We're sad that you couldn't be here tonight, but what is the best part of a pre-recorded video address? It's always in time. So nobody goes over, that's what I'm trying to say. But her passion is very important. This message from abroad was very thoughtful, and it truly reflects how IPAC translates strategic vision into community-focused programs that drive sustainable change on the ground. Ladies and gentlemen, our next segment highlights an issue that affects millions across Pakistan, yet it often goes unnoticed. While we speak freely about heart disease and diabetes, there's another form of silent suffering that's taking place in our communities, and that is poor dental health. Today's presentation, entitled Silent Suffering, the Crisis of Dental Awareness in Pakistan, will shed light upon this overlooked public health challenge and introduce IPAC Foundation's Safe Dental Program.
With that being said, it is my honor to welcome Dr. Reem Shafi, founder and CEO of Two Rivers Dental Chicago. From one clinic to a thriving network, her journey is a story of vision and excellence. I consider her my second mother, but even more so an inspiration and a powerhouse for women across the globe. She is now supervising the Safe Dentistry Program, which ensures quality services for the underprivileged in Pakistan. Please give her a round of applause as we welcome her on the stage.
Good evening and Assalamu alaikum everybody. For those who don't know me, my name is Reem Shafi. As a dentist who has been practicing in the United States, I have seen what safe, preventative, and modern dentistry can achieve. And yet, every time I visit Pakistan, I am reminded of what happens when access and awareness is missing. Over 90% of Pakistanis will experience some kind of dental disease or an issue in their lifetime. A small cavity becomes a painful infection, and an infection turns into pain, and finally, tooth loss. And what begins as a simple toothache becomes a lifelong burden of hepatitis C due to improper sterilization of instruments and reusing of needles. And here lies the tragedy. This suffering is very much preventable. Despite the scale of this crisis, oral health care is invisible in our national priorities. No screenings are offered in schools, no dental programs in primary care, no education for families. What should be a basic right has become, unfortunately, a privilege for the few. And where the system fails, quackery quickly fills in that gap. Across cities and villages, these so-called quacks or dentists operate without any licenses, without sterilization, without anesthesia. They reuse the needles, thus spreading disease like hepatitis B, C, and even HIV. A patient goes to these quacks and ends up with hepatitis C. Latest statistics are that almost 62% of hepatitis C is being spread by reuse of needles and improper sterilization. People just don't go to them because they want to. I mean, who wants to go to a dentist anyways? They go to them because they have no choice. Even in private clinics, the cost is unbearable. A simple tooth extraction can cost up to 10,000 rupees, which is sometimes a week's wages in one visit. A root canal is out of the reach for most families. So people live with pain in silence. That silence has a face. A child who can't eat because his gums hurt. A mother who hides her smile, and an elder who can no longer chew or even speak. Each lost tooth tells a story of neglect and a system that has forgotten its people. But here is the hope. 80% of oral care or oral disease is very much preventable. Prevention is not expensive. It's awareness, education, and it's dignity. That is why through IPAC Safe Dental program, we have made a promise. That is why the promise is to build a model of care where no patient is ever turned away or left behind. Our Safe Dental Clinic in Sialkot offers high-quality, infection-free treatment at no cost for those who need it most. We run school screenings, awareness camps, and community programs that are already changing lives. We also provide the opportunity to our US-based dentists to go out and help and treat these underprivileged communities and healthcare centers. We welcome these foreign-trained dentists to go out and help train and educate doctors. This is only just the beginning. Our mission is bold and clear. A safe dental clinic, like the one in Sialkot, in every IPAC community health and care center across Pakistan. So no child, no mother, no elder ever suffers from preventative dental pain again. Tonight, you can help make that vision real. Because at IPAC, we believe healthcare is not a privilege, it's a right. Together, we end the silence. We can heal the pain, and we can bring back smiles. Thank you.
Thank you, Dr. Reem. Fun fact, of course, Dr. Reem and her group of dentists are mine and my family's dental providers, of course, and her passion for promoting safe dentistry and leading by example is very prevalent because she has managed to bat 1,000. What am I talking about? all 3 of her wonderful children have followed in her footsteps. So Shane, Shamil, and Sama, who are all here, are the future of the Safe Dental Program and at the core of IPAC's dental initiatives. Nicely done. So we'll turn from silent suffering to one of Pakistan's most urgent health challenges. Affecting over 37% of the population, which equates to about 34.5 million adults, I'm speaking none other than diabetes, a chronic disease we are all too familiar with. I'd be safe to say that almost everyone in this room has someone suffering from diabetes in their extended family who is inflicted with this chronic disease. IPAC is now stepping forward with a comprehensive community-based diabetes prevention and management program. The following video will illustrate the latest initiatives IPAC is taking to address this prevalent condition.
डायबिटीज का शिकार है, लेकिन सबसे परेशान कुन बात यह है कि आधे मरीजों को ये भी नहीं पता कि वो डायबिटीज के साथ जी रहे हैं। खामोशी से बढ़ने वाली ये बीमारी लाखों जिंदगियों को निगल रही है। पाकिस्तान में 3 करोड़ 30 लाख से ज्यादा लोग डायबिटीज के साथ जिंदगी गुजार रहे हैं। ये वो तल्ख हकीकत है जो पाकिस्तान को दुनिया के उन चंद ममालिक में शामिल करती है जहां डायबिटीज की शरह सबसे ज्यादा है। अगर आज कदम न उठाया गया तो ये तादाद हर गुजरते दिन के साथ बढ़ती चली जाएगी। अक्सर लोगों में इस मर्ज की तशखीस देर से होती है, जिसका नतीजा अंधापन, दिल की बीमारियां, गुर्दों की नाकामी, अज़ा का कट जाना और यूं जिंदगी की खुशियां आहिस्ता आहिस्ता छिन जाती हैं। डायबिटीज की कई शक्लें हैं। जिस्म इंसुलिन बनाना बंद कर देता है, जो ज्यादातर बच्चों और नौजवानों को मुतासिर करती है। जिस्म इंसुलिन इस्तेमाल करने की सलाहियत खो देता है। ये सबसे आम और तर्ज़े जिंदगी से जुड़ी है। हमल के दौरान होने वाली डायबिटीज, जिसे गेस्टेशनल डायबिटीज भी बोला जाता है, जो न सिर्फ मां बल्कि आने वाली नस्ल के लिए खतरनाक साबित हो सकती है। बरवक्त जांच से ही बरवक्त बचाव मुमकिन है, लेकिन उम्मीद अभी बाकी है।
IPAC फाउंडेशन डायबिटीज के खिलाफ इस जंग को लड़ने के लिए पुरअज़्म है।
हमारा डायबिटीज प्रिवेंशन एंड मैनेजमेंट प्रोग्राम हर फर्द के लिए एक नए दौर का आगाज है, जिसमें बरवक्त तशखीस, दुरुस्त इलाज और तालीम व आगाही की सहूलियत मुयस्सर है।
IPAC फाउंडेशन के इस इक़दाम के जरिए बड़े पैमाने पर स्क्रीनिंग कैंप्स, कम्युनिटी आउटरीच और रज़ाकारों के जरिए शऊर की शम्मा रोशन की जा रही है।
डायबिटीज सिर्फ एक फर्द का मसला नहीं, ये हर घर, हर खानदान और हर नस्ल के लिए एक चैलेंज है। आज कदम बढ़ाएं ताकि कल आप और आपके प्यारे महफूज रहें। आपका दिया गया हर हथियार एक जिंदगी, एक खानदान को बेहतर बना सकता है। आइए डायबिटीज के खिलाफ इस जंग में IPAC फाउंडेशन का साथ दें। IPAC डायबिटीज प्रिवेंशन एंड मैनेजमेंट प्रोग्राम, क्योंकि जिंदगी का हर लम्हा कीमती है।
To shed more light on this important and far-reaching issue, we're honored to welcome a leader whose work has transformed the landscape of diabetes awareness and prevention, and aims to do the same through founding this program. Dr. Nuzhat Jalisa is a renowned endocrinologist with over 23 years of experience. Not only is she the founder of the Kisset Diabetes Organization, a platform committed to education and early intervention, she's also the author of Diabetes Beyond Numbers, a guiding resource that helps patients and families understand the human side of this disease. Beyond that, she serves in a leadership role with the American Diabetes Association and is recognized globally as an international speaker and TV host of the program Diabetes Beyond Numbers. Please join me in welcoming Dr. Nuzhat Jalisa to the stage.
Good evening, everyone. Assalamu alaikum. Thank you for joining us today. Diabetes has always been personal to me. It is not my profession, but it is my passion. Coming from a family with several family members affected by diabetes, my passion deepened when I lost my father to complications of diabetes, like going on dialysis, having cardiovascular disease, and was about to lose both his feet, but he died shortly before that. This inspired me to found Kisset Diabetes Organization, a non-profit dedicated to early screening and education for the underserved communities. Many of you have supported our initiatives for past 10 years, and I'm extremely thankful to you for that. During our educational sessions, I recognized a major gap in awareness and understanding of diabetes, which led me to write my book, Diabetes Beyond Numbers. During COVID pandemic, I started a virtual diabetes clinic that unexpectedly connected me with a lot of people from Pakistan, revealing an even bigger and greater lack of resources and knowledge back home. When Dr. Shafi proposed integrating diabetes program into IPAC, it aligned perfectly with my long-held vision. Over the past year, I have been researching diabetes initiatives in Pakistan and found only a small-scale programs highlighting urgent need for a broader action. Pakistan currently has the highest prevalence of diabetes in the world. With a total population of 130 million, currently 33 million people in Pakistan have diabetes. This means nearly 1 in 3 or 4 adults in Pakistan is living with diabetes. Additionally, we have another 11 million people living with pre-diabetes, which is a completely preventable condition. A stage when blood glucose levels are high, but not yet in diabetic range. And with timely intervention, and without timely intervention, up to 70% of these individuals will develop diabetes in the next few years. This group represents a major opportunity for prevention through lifestyle modification and community education programs. Between 8 to 9 million remain undiagnosed, meaning that they are unaware of their condition, and then there is a huge ocean of people who are at risk. So why is this happening? One of the most common reasons for diabetes epidemic in Pakistan is lack of awareness and education. If you are not aware of your diagnosis or symptoms of diabetes, you won't be taking any action. Even for those who know that they have diabetes, they are unaware of the complications that it can lead to, and therefore does not seek help until it's too late. Pakistani diet relies heavily on refined carbohydrates such as roti and rice. Frequent use of sweets such as mithai during celebrations add to the sugar intake, not to mention beverages like tea and lassi with sugar. Many individuals seek advice from unqualified practitioners or community healers, which I saw during my Zoom clinics. Common myths like diabetes is caused by stress or overuse of sugar and other products is common in Pakistan. Other than that, South Asians, including Pakistan, have a genetic predisposition to store fat around abdominal organs, what we call visceral fat, which is highly associated with cardiovascular disease and complications. Most people in Pakistan are lean, that is our genetics. They do not look obese, but they may have abdominal obesity, which is a sign of insulin resistance and puts them at very high risk for diabetes. But since people don't look obese, they feel like they are healthy. At the government level, there's very few preventive care and primary care services. You just heard from Dr. Shafi's talk about that. Most healthcare facilities focuses either on acute care or chronic disease management, but not on preventive care. Routine screening and early detection programs are limited. Affordability is another massive obstacle. Most diabetes medications, including insulin, is simply out of reach for people who live on less than $3 a day. There is no centralized registry to monitor diabetes complications like kidney failure, nephropathy, neuropathy, and amputations. So how do we solve this problem? We urgently need national programs for educating people about healthy lifestyle from school to community centers. Awareness is the key. People must understand that diabetes prevention begins with everyday choices of food, activity, and weight management. We need focused diabetes screening and educational programs both in urban and rural areas, reaching those highest at risk. Mobile clinics and community health workers can help identify and diagnose cases and provide basic education where access is limited. We need to educate our underserved population and provide them with affordable solutions. We need to educate them on making healthier swaps like brown rice instead of white rice, or using less oil and sugar in cooking. Bottom line is, within a national combining program, combining screening, education, and prevention. So just a brief outlook of what we are planning for our diabetes prevention program with IPAC. The first step in our program is to integrate diabetes screening into our existing hepatitis screening camps. We aim to screen about 15,000 individuals in the first year. Individuals who test positive for diabetes will be referred to IPAC community health centers where they are available. In areas without IPAC centers, patients will be connected to a network of partner institutions with whom IPAC is developing collaborations. All participants will receive practical and affordable counseling and education tailored to their needs. Those without diabetes will receive guidance on prevention. Those with diabetes will receive support on disease management and prevention of complications, which is a huge thing when it comes to diabetes. A registry of all screened individuals will be maintained, allowing data collection to support future studies and program improvement. Physical activity counseling will be provided, focusing on simple, realistic ways for participants to stay active. Looking ahead, IPAC plans to establish a formal diabetes clinics within existing community centers and expand to new locations. At present, we have several IPAC locations throughout the country. We do not have one in Karachi, but inshallah we plan to launch an IPAC diabetes program in Karachi soon. We cannot do this alone. We need your support to make this happen. Together, we can reach more people, raise awareness, and make a lasting difference in this fight against diabetes. Thank you so much.
Thank you, Dr. Nuzhat, for your dedication and your leadership in bringing structured diabetes care to communities that need it most. I'm now going to move on to our last speaker of the evening. Here's to support IPAC's Foundation mission. We now welcome a leader who has transformed philanthropy through empathy and scale. Mr. Azhar Hamid, who's the global president of Aquat USA, founder of Umano, and board member of beloved TCF USA, he is a true change maker. I want you to join me in welcoming Mr. Azhar Hamid.
Thank you very much. Assalamu alaikum. Good evening to everybody. I just feel a little trapped behind these boxes, so I'm just going to use a free mic. I was Googling, there's something in the name of this family, Shafi. I just checked, Shafi means the one who brings healing to others. And Shafi, which is mispronounced very easily, also means the one who pleads for others to bring healing to others. So this family has the burden of the name that they have given by Surya, and the great mother who's brought up such great children. Thank you so much. In the next 8 odd minutes, I'm going to be like a goat. I'm going to do a lot of meh, which translates to me in English. And I hope that by the end of when I'm done, you will join me in the Me Too movement. Not the Me Too that scares the living daylights of men these days, but Me Too in terms of, yes, we want to be part of this great journey that has been started by Dr. Shafi and the family. Yesterday I was having a great meal at Masuma Man's dinner at Shafi's house, and turns out she's from Rawalpindi, so am I. We both went to the same school, Station School, Rawalpindi. And turns out we lived on the same street, Harley Street in Rawalpindi. So this was a divine intervention for me to be here. And a little bit of nepotism that we didn't even know was playing a role. Ladies and gentlemen, I had a very quick certificate of Jamaat Islami in Punjab University in Chemical Engineering, otherwise known as Hundaism, because that's all we learn over there while we were Jamaatiya. And then because I had no money, I come from a very underprivileged family in which nobody went to college. My only ticket to being here today was education. And there was no better country in the world than USA. Problem was, slight one, I didn't have any money. So I landed in the University of Oklahoma with $50, and I got a degree in dishwashing and pizza delivery, otherwise known as computer science by some. Because I was such a pathetic student, thank God, what a blessing, because if I was a good student, I would have gotten a job somewhere, I may still be working. So most people who are not very good, they don't get a job, they give themselves a job called entrepreneurship. It just worked out. In 2008, I retired when I was 45, and there was a new dilemma on hand. I didn't have an exit plan. I had no plan it's going to happen. In cricket, we call it chicka. So I had my chicka on the last ball, and the next thing was that my wife came running to me, Farah, cousin Sarwa is here, and she said, there's a problem, the bank made an error. There are a lot of zeros in our bank account. I asked, where's the decimal, on this side of the zeros or this side of the zeros? She says, on that side. I said, it's not an error, I just told the company. The big question is that when you are at a plan and you have no plan, you do, I'm sure like most of you guys do, you just give it away because my wife is too frugal to spend. I was doing a quick math. If I was to auction all her assets today, it'll be around less than $5,000, including everything. And mine will go to Salvation Army because I buy my clothes from Ross and TJ Maxx. So when I lost my glasses today, I said, Dr. Shafi, did you find my glasses? He said, I'll keep them, they're expensive. I said, the tag is only at $9.99, so keep it. The question was that I'm a sort of a second, third grade poet, so I wrote a poem called PK 786. PK is Pakistan International Airlines, like American Airlines will have AAA. And the share was, I took an allegorical example of every landing instructions that they give you when the plane is about to land as a metaphor of life's landing. And one of the couplets said, हवाओं का दबाव कम होने पे मास्क फौरन पहन लेना, सफर खत्म होने से पहले कर्ज सारा उतार देना. So I told my wife कि आज हम पे कर्ज चढ़ गया है. उस कर्ज को how do you get out the debt? For my friends who don't understand Urdu, it simply translates it that we give a landing instruction where you mask, when the oxygen level drops in the plane, and the metaphor was you get rid of all your debts before you run out of oxygen. I was thinking, and then something actually hit me that I've struggled for a long time. I'm sure most of you guys have heard a very famous couplet of Mirza Ghalib. Kuch na tha to khuda tha, kuch na hota to khuda hota, डबोया मुझको होने में, न होता मैं तो क्या होता. It has a lot of meanings, but that day I understood the meaning. What if I was never born? I don't know, but I know what would have not happened. I would have not consumed 60 million gallons of clean drinking water that the world needs to keep me around 8 years on the planet. I know there would have been 1,100 less cubic the emission of carbon that comes out because of my existence, and 45,000 tree years of oxygen that I consume. I have a huge ecological footprint on the planet for just being around. Somebody invested in my presence on the planet. We usually call this nice person God, or mystery, or whoever you believe in. So where is the return of this asset that I am? A liability on the balance sheet. How do I turn this liability into an asset? Tagore once said that I thought life was a joy. I dreamt and I woke up and found life was service. I served and found out service is joy. Ladies and gentlemen, I think, in my humble opinion, the best way to write off your debt is to write your own eulogy. because then you can live your eulogy while you're still alive. Have you noticed that there are 3 times in a man's life when they are told good things on their face? When a boy is born, most of the time you have to say, what a beautiful child, even, some children are just not as beautiful as you like them to be, unless you hear, Dadka de gaya is taken after their dad's family, what the right? The second time here, which is very amazing, it's new to us culturally, when boys are getting married in this country, it looks like another eulogy. All the friends give it to them at their wedding. Looks like it's the best thing that ever happened to the girls that never got married. To this guy, what a catch that nobody wanted to catch. And the third time, when people say a lot of good things to you is when you're dead. Have you realized dead people are the nicest people? You have just never done anything wrong in life. So if you're good, beware. Maybe your number is coming soon. My eulogy is simple. I want to die light so that I can understand what Bulle Shah said. Bulle Shah said, Bulle Shah samvarna nahi, gur pyar koi aur. Bulle Shah said, I'm not going to die because the one in the grave is not me. Then who is me? The one that travels and leaves the body debt-free. And what is the debt on me? The debt of injustice, of social discrimination, of having too much than what I need. And if you're a believer and a Muslim, in Surah Baqarah, it says, they ask me, what should I give in charity? And God says, give all that you don't need. I am a super anti-hoarding guy. There is no scarcity in this world of resources, ladies and gentlemen. There's hoarding of resources in this world by me, because I hoard a lot more than I need to be happy. And if we share this circular distribution of wealth with a platform like IPAC and many good others, we have to do nothing more than just write a check. That's doing nothing, because like Ashfaq Ahmed says, Ditliyon vichcho ditta. You've given from what has been given to you. It's not even yours. But when you start giving your time, like the Shafi family is giving, and your talent, you started to give. So in the end, my message is, be a billionaire, be a zillionaire. And Sant Kabir says, Bada hua to kya hua, jaise ped khajur, pathi ko chhaya nahi, phal lage itni dur. The palm tree is tall, but it's useless for the shade, and the fruit is unreachable. So one day I can also die like Bulle Shah and say, Azhar Hamid, main marna nahi, gor pyar koi aur. Thank you.
Thank you, Mr. Azhar. Your words remind us of the power of collective action to bring hope when it's needed the most.
And now, the moment where your generosity can turn vision into reality. This important work cannot continue without your contributions. And something that Brother Raja just said that I want to kind of relay before we get into the segment. The person who is in need, they need you as much as you need them. You may have heard that, okay? It is truly a blessing to be in a position where you are the answer to someone's prayer. It's a blessing that we all need and can take advantage of. So, tonight we've heard incredible stories. Stories of innovation, compassion, and the power of prevention.
Now, you have the chance to be part of that story, to help IPAC's mission grow and reach even more communities in need. And to help with that, please welcome Omer Siraj and Amr Jalisa to the stage to begin our fundraising session. Thank you.
Get the microphone out.
It's wired. This one's not.
Is that?
Wired.
All right, next. All right, Oman, go ahead. It's all yours.
Oh, it's all mine. Okay. I thought you were starting. Okay.
You're the more good-looking one, man. People give you more money than me.
We're here for fundraising, or?
Yeah, you live in Oprah, I live in Naperville. I live in the poor town of the country.
First of all, I'd like to recognize the Shafi family, Samir Bhai, Sohail Bhai, Reem, and Masuma Bhabi, for the outstanding effort that has been made today. This is not curated, I'm just speaking from my heart. I think so many of us are drowned in life as we speak. I mean, I barely made it here on time. And there's somebody else here in the community who's not only making it here, but organizing all this. And then you listen for the past hour and you realize that the magnitude of effort, time, breadth and depth of what has gone into this, to come this far for how many years?
Almost 10 years.
10 years, for a decade of effort that has gone in to benefit the lives of someone that we don't know, that we have no connection with, except the fact that they come from a similar geography, ethnicity, possibly religion that we come from. There's an association. And Dr. Shafi and his family has relentlessly pursued this on their own for all this time. And now after a decade, they're like, okay, we've done what we can and we want to continue, but this is working. Can we do this in a bigger way? Can we not only get help, but give an opportunity to others to participate? And I'm speaking from my heart. I mean, this is why I'm here. I'm not a professional fundraiser. And I was laughing with him. I was like, people will start ignoring me if I start keeping asking for money. But at the end of the day, if we believe that we are someone who are blessed, I do. I'm extremely humble. I tell my wife, Marjana, every single day, say thank you every morning. Not because we were smart, but we were lucky. We had the opportunity to be here. And if we recognize that there's a large mass out there that are not as lucky as we are, and we have an inherent desire, a moral call, a religious call, a faith call, to help them, then here is our platform. I mean, the magnitude of the programs from hepatitis C to hepatitis B to HIV to oral health to diabetes. I mean, there's an enormity of programs and interventions that can be made just for someone to be healthy enough to then go to school and make a difference in their life. So I think prevention is at a pivotal sense to make a difference. And I'm here to urge each one of you that if you feel that there's a difference that you want to make, then we have an extremely comprehensive and credible platform. I personally put my faith and my name out here to support this cause. And I would urge each one of you.
So well said, Umair. And I think when I joined IPAC, I realized that a lot of hospitals are in Pakistan. Lots of people are doing great things. But prevention is something that even I had not thought about. And I thought prevention is something that can help a whole lot of people not reach the stage where they have to go to a hospital and they have to be treated. So a lot of people think about just the fact that they need to be treated, but we never think about the prevention side of it. So let's look at some of these slides, some of the things that the previous speakers talked about. We have an eye clinic, we have a cardiology clinic, we talked about the diagnostic labs, immunization clinics, the pharmacy.
Let's start with the Jung project.
Yeah, and if we can please get to the
So
project.
first and foremost, we have the Jung project. Why Jung? From what I'm learning, and this is a learning process, that Jung is one of the most hardly hit, severely hit population with hepatitis.
20% population.
20% as opposed to?
7%.
As opposed to 7%. So more than double, almost 3 times the percentage of population is hepatitis infected for the reasons that have been already explained. We don't need to establish that. So based on that, the effort, the initiative of IPAC has recognized that geography to be biggest impact for every dollar put in, because they're bleeding, they're hurting the most. And in that spirit, there is a tremendous amount of effort being made to design a Jan project, a Jan health center, which costs a fortune, but not a fortune for us, a fortune for the population of Jan. And that's the bridging that we're trying to do.
And think about the 20,000 people annually that we are targeting in that community center that Umair just talked about. That's a center that's being built. It will be built very soon. There's obviously running cost of that. There's also a lot of things that need to be done that requires money, because anything that's built, anything that's run requires money. So we already have our first donation from Samira Hussain for $50,000. Thank you so much. Thank you so much for $50,000 donation for the IPAC Foundation.
Often I hear about put your money where your mouth is. It's easy to ask others for money. So I was going to humbly announce my donation, but this has been more serious. So I understand that Amir has been gracious and humble enough not to announce to donate $10,000, and Amir and his family. And I would like to match that with a $10,000 donation myself.
Thank you so much.
And I was able to scrape out another $5,000 from my brother who could make it here. So it will be $15,000.
And then here we go, Dr. Shafi himself and Masuma Shafi are gracious to donate $50,000 for the Jung project. So thank you so much, Dr. Shafi. You're already doing so much and you're adding more to that. So as we talked about that particular program, you've got 20,000 people treated annually. The community health center, we've already got 2 canals of land that have been provided. 20 canals of land, sorry, that says 2. 16 canal land allocated by the Deputy Commissioner Office of Jung. So that is a really, really good program. So please try your best to put whatever amount helps us with that. Go ahead, Umar.
There is a scan code at the bottom of the pledge sheet, so please feel welcome to scan that and make your pledges. I think we had specifics about the project, right?
So basically, the Punjab Government Red Crescent Society has donated 20 canals of land to us. We signed an MOU with Deputy Commissioner and the government officials a few months ago. So we, inshallah, are going to be starting the construction very soon in January. It's going to be a state-of-the-art community health center with outpatient hepatitis, HIV, TB clinics, eye clinic, dental clinic. And that's going to be one of very iconic projects of IPAC Foundation, and I'm so much excited about this, the impact. As a matter of fact, every place when I do a project, I like to go there. And I've been to Karachi many times, and Changa, I had the privilege of going there 2 years ago with Rana Zahid. And absolutely, it was devastating to see hospitals packed with young patients with hepatitis C, liver failure. They were like floors, filled with patients, young patients who are, like workers, and they are dying. I've never had such a bad feeling. I think that was the moment really where I said to Dr. Zahid Bhai that we have to do something for Jhang. And that's how we identify locations. Maybe we are not from Jhang, but we all are human beings. I think the humanity binds us. So please, I think this iconic project is really, I know how much impact, not only it's going to do for inside the center, but because we do so much outreach activities and outreach camps through the same staff, that we actually map the whole Jhang area, the villages. IPAC Foundation, that's what makes us different, that we go out in the communities, we map the city, the villages. Every month there are camps going on, and we do not stop until we see that hepatitis is really eliminated from the whole Jhang, from the communities around it. So that's how we operate, that's how we are different. So please donate generously for this project.
Thank you so much, Dr.
You can write on your cards, and the ushers can bring the cards here. Okay?
Yeah, so just a little bit more details. The project cost is about $600,000. That includes the construction, the medical equipment, the furnishing and furniture, IT and electronics. Any amount of this money would help. We just need to get to the $600,000 number. So let me give you a couple of donations. Mr. Naveed Anwar for $25,120. Thank you, Naveed sir.
We have a $1,500 donation. It's anonymous. Thank you very much. I appreciate it.
We have a $5,000 donation from Sharmila Ansar. Thank you so much, Sharmila.
Yeah, Sharmila Tagore? No, Ansari. Shamila Ansari, sorry.
So we need to reach the 600,000 for that. So if any amount of donations can be done, as Dr. Shafi said, you have the IPAC Gala card here. You can choose a specific program. This has the Rana Zahid Community Health Center, hepatitis, diabetes, pharmacy. You can donate one time. You can also donate monthly through a credit card. You can do quarterly. You can do yearly. And there's different ways to donate: by a check, by a credit card, on the website, by bank transfer, and
we
wire
have
transfer.
our brother Moeen Haq, who is here for $5,000 donation. This is above and beyond the tremendous amount of donations he's already given to this initiative. He's also suffered, if I may, in HIPAA violation, some personal health challenges for which he should not be visiting here, but this is so close to his heart that he put on a face mask and he's here. So we'll give
I want to announce that $150,000 donation from Zahid Bhai for this project. Okay. Thank you so much.
Thank you so much. We've got a $5,000 donation from Anwar and Fatima Ali Momal. Thank you so much. All right, can we move the slide so we can talk about some of the other projects as well? We continue to talk about the jump project.
While we speak of the project, Amir is the sniper, I'm the shotgun. The philosophy goes that whenever I got involved in charity, they said, wash your money, And we don't know too many people who went broke because they gave too much to charity. So if there is I do believe that deep down in our culture, in our religion, in our society, in our humanity, there's an inherent understanding that we want to help the ones who are not as fortunate as us. It's not about the quantity, it's about the gesture.
Absolutely.
And in that spirit, I urge each one of you to do something tonight for this initiative.
And every dollar amount helps, right? It doesn't matter whether it's $1,000, $5,000, $25,000. We have a donation here from Ijaz and Fatima Shamim for $20,000. Thank you so much. All right, let's talk about the mobile van real quick. So as you see on the slide there, the total cost for a mobile van is $48,000, $26,000 for the vehicle itself and fabrications to make the vehicle worthwhile to visit different places. And this is a mobile van, as you heard earlier, wants to go to the places where other places people cannot go. So there's also a project on that. $48,000. I would hope that we can find one person to just donate $48,000 to get one mobile van, so we at least get started with that.
We have a very generous friend, Arshad Javed Bhai, who's always giving. He's offered $10,000. Thank you. Please note that if you go on the QR code and fill the form, you still need to do the math.
Abdurrahman Bhai has announced $75,000. Thank you so much, Abdurrahman, for Chan project. Please, let's start writing our donation so that we can start the dinner. I know it's getting late, but we really truly appreciate, I think your presence really means so much. This was meant to be more like an introduction, but
with Faisal and Aisha Sami, we have $5,000. Thank you very much, Faisal. We have Azhar Hamid from $25,000. This is the gentleman who gave us poetry, who gave us his warmth, gave us his trip all the way from LA to come down, and now is donated. Thank you.
Thank you so much, Azhar Bhai. Your presence means so much. I think you really are a role model.
We have a donation from Mashkur Ali Khan, specifically for the hepatitis infection prevention for $2,000. Thank you so much.
We have Sohail and Reem Shafi for everything that you already do. Thank you for the $70,000.
For Mr. Abdul Ghani for $5,000. Thank you so much, Abdul Ghani, for $5,000.
You're a wonderful donor who's written the check right away. It's not a pledge form, so nobody has to work to follow.
All right, let's talk about the pledge for pharmacy.
It's anonymous.
Quick, you want to cover the pharmacy?
Please go ahead.
All right, so pledge for pharmacies, the monthly cost is $2,000. The annual cost for running a pharmacy is $24,000. That includes serving over 1,000 patients of non-communicable disease, such as diabetes, hypertension, and other include. So $24,000 cost for that. If I can have a few people that can please think about donating for the pharmacy.
Umar Tariq, the pharmacy is completely zakat eligible. We give diabetes medicine, blood pressure medicine, hepatitis, all these are completely free to those people who cannot afford. So we are completely zakat eligible.
With Umar Tariq, $2,500. Junaid Ahmed, $5,000. Thank you.
So, just as the legal counsel, I have one.
We have an anonymous one, $2,000. Another anonymous, $1,000.
Yeah.
All donations are 501c3 deductible.
Yes, all donations are 501c deductible and they will be getting a receipt. Talat Kamran and Muhammad Kamran for $1,000. Thank you so much.
We've clearly not rehearsed this, so we're talking all over each other. Sorry.
But on top of that, what Dr. Shafi just said was that particular pharmacy project was zakat eligible. So we all have to give zakat. If we can give some of it here, that would be amazing.
Absolutely. Amir Hanif Saab for $3,000. Thank you so much.
Once again, our thanks to our new Consul General, Zaman Saab, who is sitting here through the whole journey, because I know how busy you are and how many invitations you're getting in the community every evening. And Naveed Shirani Saab, who stayed back especially for this fundraiser. Appreciate it. Thank you.
My good friend Talhavati for $5,000. $10,000. Congratulations, Allah. Thank you so much.
So this is just a rough estimate, but you're probably around $400,000 right now.
Awesome. Well, we need to get to this $1 million mark. I promised Abdul Rahman Saab, no dinner before million, right?
$1,500 anonymous, $1,000 anonymous. I'm really appreciating the anonymity. We like to announce the names because we want to inspire others, but I understand the humility here.
Mr. and Mrs. Hussein Khan, Shirani and Ariana for $1,000.
Mr. Tariq Hamid and Sarwat Shaheen, $2,000.
Almas Khan for $5,000. Thank you so much.
Shaida Khan for $5,000. Thank you very much.
Samira, thank you so much. Samira, I already donated 50,000. You're donating another 20,000. So Samira is donating 20,000 more, total of $70,000 donation. Mashallah. Mashallah. $70,000.
हम सब की तरफ से.
And for those of you, who have not visited Pakistan, please do visit. We have corporate office in Lahore. We will arrange visits to all those clinics for you. We're going to make your visit so memorable, so rewarding, because I want you to see those patients who are getting benefit. We want to see those centers that really operate in the same way as an American clinic. They have EMRs. Their staff is trained to be compassionate, so please do visit Pakistan. This is an opportunity. We will provide you all the resources to make your visit memorable. Rana Rehan has donated $25,000. Thank you so much.
Jazakallah. Aliza and Shane Shafi for $1,000. Another anonymous donation for $1,000.
Amir and Anna Akhtar, $7,500. Thank you, Amir, for flying all the way. Amir is, by the way, my cousin. Anna, they all flew from Los Angeles just for one day for this. This really means so much to us. Thank you, Anna and Amir.
Can we change the slide? Go to the next slide, please.
Yes.
Go past the pharmacy. All right. So you heard the Pledge for Diabetes Prevention and Screening Program. So think about this, guys, and you heard Nusrat talked about this earlier. It costs less than $1 to screen one patient in Pakistan. Less than $1. So our goal is to do 15,000 patients every month if we can, and that costs $10,000. Can I get one person to donate $10,000 for diabetes screening? You heard that's one of, 37% of the country?
37%.
37%. Can I get one person please to donate $10,000 for the diabetes clinic so we can screen 15,000 patients?
Just another reminder, if you fill out the QR code, you still have to fill out the pledge card on your seat. That way we can announce your generous donations as well.
Yeah, so if you scan it, it takes you to a website so you can enter the information, or if you want to pay it by credit card. I think we just need to wrap it up because the dinner is ready. For those of you who have not written their pledge card, they can still write it and give it to us later. We again appreciate you. Zawab, Mehdi, please come over, say some few words.
Thank you very much. And since there have been speeches by people who are much better qualified than me, so I'll be very quick. First, this is my probably 14th or 15th day in Chicago. And every day the community here continues to amaze me. It's not just the professional excellence. It's the fact that you guys are self-driven. You're connected with your country and you're making an impact. So it's an honor for me to be here. Second, I think in supporting Shafi Saab and Rana Saab in prevention and in primary healthcare, it's not just an act of generosity and compassion. You're making a strategic investment. It's the whole healthcare that you support, because weakness at the primary level generates stresses at the secondary and the tertiary level. So it's not just supporting prevention, it's basically an investment in the entire bandwidth of our healthcare. So with that, thank you so much, Shafi Saab, your passion. I think it would be accurate to say that it's an IPAC movement. Not just because you're passionate, but also because you've trained such a large number of volunteers. So you're already there.
We are the largest volunteer body in Pakistan.
Exactly. So thank you so much.
All right, two other quick announcements. We have one more pledge. We have one more pledge from Qasim Bhatti for $2,500. And then also I'd just like to recognize a couple more people. I'd like to recognize Naveed Sherwani Saab. He was here on a visit for Open Chicago annual meeting, and then we asked him to stay back for that. So should we ask Naveed Sherwani to come up, please? Naveed bhai, please come up.
For those of you who do not know Naveed bhai, I think he's Satare Jihaz, mashallah, he's an iconic figure. Flew all the way from Saudi Arabia. I learned about you. Such an inspiring journey, such a wonderful personality. We're so proud and we're so glad that you are here with us.
Thank you, sir. No, it's a wonderful effort. I just heard about it for the first time. It's very impressive what Shafi family has done. And to be very honest, anybody who tells me they're doing something in Pakistan, I say, and they say, is it a good thing to support this or that? I say only one thing. Pakistan is a huge ocean. These are all small qatras. Every qatra is very valuable. So whatever you can do to help and support, you should do that. It's an amazing effort, and I really thank you for doing it. And by the way, you're a great speaker. I look for great speakers. So thank you very much.
Thank you. So we have just a few these souvenirs for our guests.
We have a couple more pledges. Saab, if I can do that. Also, we would like to recognize our Deputy Council General Saeed Ali Saab. Thank you so much for joining us today. So we have an anonymous donation for $1,000. Thank you so much. Adiba Ahmed for $2,000. Thank you so much. Malia Ehsan and Ehsan Siddiqui for $1,000. Thank you so much. And then we have another anonymous donation for $2,000.
Good. So Azhar Hamid, we would like to come to the stage to give you this souvenir for being with us and supporting support for preventive healthcare in Pakistan. And for those of you, as I did not know Azhar Bhai just recently in Kuwait, and I think the way we have connected and the way I think he has gotten up a message of prevention really has been so much. I've been inspired by you, but I'm also so much encouraged that you have your you are mentoring us in this journey.
And most of all, he made us laugh too.
If I can ask Council General Zaman Mehdi to please come up and receive an award on behalf of IPAC Foundation.
It's not, it's just a souvenir for being here.
If I can ask Naveed Sherwani to please come up and receive an award on behalf of the organization. Naveed bhai, please come up.
Just a souvenir that you attended with us, you know. Thank you very much.
Thank you. All right, 4 more. Anonymous for $1,000. Samina Hijab for $1,000. Thank you so much. Tamina Bajwa for $1,000. Another anonymous for $1,000. And then finally, Sohail Khan for $1,000. Mustafa Abdullah for $5,000, mashallah. Anonymous for $1,000. Shahid Essence for $1,000. And another anonymous for $1,000. Again, thank you so much on behalf of Umair and myself and Dr. Shafi. Sorry to keep you guys this late, but this does serve a purpose that we are. If they're not million, then we'll come back after dinner. So now I'm going to give it back to the MCs and they will announce the table numbers. Thank you so much.
And Umair, $500,000 in about 25 minutes. That is quite a feat, so thank you. Like I said, 501c3, tax deductible. Today is officially November 1st. You only have 60 days to get in those 2025 tax deductions. So as you enjoy the Anmol dinner and have fun with the music entertainment, consider filling out one of these pledge cards. We will update, like we said, we're right about $500,000 if my mental math does me right, but we'll email you guys, inshallah, like how well we do. So, what a powerful evening it's been, Shanur. And can I get a round of applause for my co-host here, Shanur Shafi? This is like her going away party because, as I said, she's going to NYU. She's going to New York in the new year, which is, of course, where I'm from. So I'm a little biased for my wife. It's the best city in the world. So I'm very excited for you. And she's also my favorite Shafi. Sorry, Shahan, because Shanur is going to be a lawyer or studying to be a lawyer. So I was able to get one of them, one of the many Shafis to go into the legal round, inshallah. So. On behalf of the IPAC Foundation, we sincerely thank each and every one of you for being a part of the IPAC story, from believing in its vision to supporting its future.
And thank you, Salman. I just want to say again, we appreciate your time, and I want to emphasize patience as well. And your heartfelt generosity, it means a lot to my family, and it means a lot to IPAC Foundation. And we are so excited to show you guys truly the impact that this money and this fundraiser has made. Just always remember one thing. Prevention is better than cure. And together, we can change the trajectory of our beloved Pakistan. And now, I know you guys have all been waiting for dinner, so I'd like to call tables 1, 2, and 3. Dinner is now served. Thank you guys so much. I'll call them as they go, guys, I promise. So we'll just have, to keep it organized, we'll just have the first round tables go ahead. The first 5.
This one moves my needle about $50,000, so. Aftab Uncle, thank you. $2,500 from Aftab Khan. Thank you. because everybody already went, so